So my daughter had an implant done from her regular dentist where they put crown on and did all the finishing touches of that. Could you have done that for her?
No, I can't. After I leave dental school and I become an oral surgeon, my practice is limited to oral and maxillofacial surgery, so I'm not ethically allowed to do general dentistry. I can't do crowns or cleanings or bridges. I had a patient today ask me to do a crown while she was asleep having her wisdom teeth out, and I had to respectfully decline. But general dentists can ethically do all the things that I do with proper training, but they can do all the wisdom teeth removal and dental implant placements. But it's kind of frustrating for patients because they come to me and I place the implant and I follow them through their healing phase, and then when I'm done I have to send them back to their dentist, and I think they get a little frustrated at that point, but the end result is better.
Right, and when they understand that process and how they are getting the expert details of that first initial implant, I think it's important to go through that process knowing you're going to have the best result and it's going to be a longer lasting.
And it's a process, I like to call it the medical model. I mean, it's how the physicians treat their patients. If you're diagnosed with cancer of some form, you're sent to an oncologist. Your family practitioner is not going to try to treat your cancer. If the cancer needs to be removed, you go to a cancer surgeon. Your family practitioner is not going to treat the cancer. So it's just a very similar model to what we see in medicine, where patients are sent to specialists to deal with the specialty work.
So then how do you collaborate with other dentists to give your patient the full service?
Well, a lot of my referring doctors I've worked with for years, and we've taught each other a lot, and we know exactly what we need and what needs to be done for each patient. But collaboration is a huge part. It's a big part of success that doesn't really get talked about much in the literature. And collaboration can just be a phone call or an email or meet together at some point to go over cases. But every dentist is a little different. Some prefer text messages and some prefer sit down face to face. So you have to feel out your referring doctors and do what they want you to do in terms of communicating patients.
So then you probably have a lot of relationships with a lot of different dentists that you can, even learn about the patient and be able to work together and give that patient the full service they need.
Absolutely.
That's great.
Yeah.